everyone, and thank you for joining us. I'm Shannon Nickinson, Editor-in-Chief of Progress+Promise.com, and we want to thank you so much for responding to both the show and the website. I'm so pleased that y'all are checking us out at Progress+Promise.com, that you're liking us on Facebook, that you're following us on Twitter, that you're sharing your stories, and you're really responding to what we want to do with the show and with the website, which is to have a positive, constructive dialogue, to highlight the successes in our community, and also to focus on our challenges in a not mean-spirited, progressive kind of way. And one of the things that we want to do with the show today is focus on the good folks who are doing work in the nonprofit world, who are helping us address some of the challenges that we have in the community, especially dealing with the poverty that we have to face. Being thankful is on everyone's mind this time of year, but need is not confined to the calendar. And in our area, the need is great. Escambia County is the poorest metropolitan area in the state of Florida. Nearly 50% of our neighbors are without health insurance. Only 23% of the population in the county has a bachelor's degree or higher. Nearly 17% of the people in this county live below the poverty line. These statistics cost us as a community in terms of economic development, business recruiting and retention, and in our social service expenses. It also takes a toll on the people behind those statistics. But there are good folks in the nonprofit community who work every day to bridge the gap and make sure that this community's reputation for generosity extends to cover those of our neighbors who are in need. And we are lucky because some of them are with us today to share their stories. Our first guest is Jessica Simpson. She's the Executive Director of Health and Hope Clinic. The clinic offers free health care to those who don't have it. And the estimate is that nearly 88,500 people in Escambia County have no health insurance of any kind, which means there are an awful lot of folks for Jessica's agency to help. Hi, Jessica. Thank you so much for being with us today.
Thank you for having me.
You bet. Tell us some about Health and Hope's mission and values and what you're working on. You have some exciting news in your world.
At Health and Hope, basically our mission is to provide health and hope to those that are hurting in our community. We started as an urgent care facility, but learned the need and the sickness that was in our community, the ongoing chronic diseases, and so we are a medical home for those that are eligible through financial eligibility standards and guidelines, and so we provide doctor's care to them, mainly generalist care, but also specialists. We have a lot of specialists on board. They're all volunteers. We're a volunteer-run clinic, like a lot of the other free clinics in our area. I don't know if you've heard of Good Samaritan Clinic or St. Joe's downtown. So just like them, we provide free healthcare, medications, labs, all that are needed for access to that to our community. And we're enjoying it very much, partnering with some agencies that have sort of come alongside our mission, and we have a clinic in Century that has expanded in hours, and in the footprint in the building that we're in, we've expanded to include more exam rooms, and that way to take on more patients that need it. And then we have a couple of churches that have kind of launched us into new buildings, and we're moving to a new, much bigger building for our main clinic here in Pensacola. And then our future is bright with a clinic near Baptist Hospital, if you're familiar with that area, over in that side of town. And our vision is really to have a network of small clinics because the transportation need in our area is so great, and being in one central location can limit the patients and their ability to get to us. So we're just loving being here in this community. It's an extremely giving community, and our patients are just like you and me. They're our neighbors and people you wouldn't know, the faces you see every day. And so we're just blessed to be here to do the work we do.
How many patients do you serve currently?
Currently, on a yearly basis, we have an active patient roster of about 1,200. We have seen in the 10 years that we've been open almost 4,000 patients. So some of them move in and out or get health insurance. Our patients don't have any sort of health insurance and don't get any sort of government assistance. So they're sort of in that gap of getting nothing. And so that's the demographic of our patients and the number that we see on a daily basis.
Tell us about the partnership that you have with Olive Baptist Church. You have a great new facility that's opened up on their campus recently.
We do, yep. About 4 years ago, Olive had a vision to give us a new building. We currently have a building that we share with the Pensacola Bay Baptist Association, and we're thankful for that. But Olive Pastor Traylor put it to his church and his congregation to give us our own building that was big enough to serve, the needs that we have, which couldn't be I mean, if we had a building big enough to serve our needs, that would be a blessing. But so our new building is actually on the campus of Ministry Village at Olive. It's about 5,000 square feet, a size and a half bigger than what we have now. And it's actually going to include dental care, which is not a service that we've had before. So a big need there.
And you have another partnership that has been in the works for a little while, but now is really kind of blossoming with Reverend LuTimothy May at Friendship Missionary Baptist Church.
Right, through some different things that happened, Reverend May moved and things opened up in that regard, and so we were able to have a building donated that actually used to be a doctor's office. Reverend May used it for his church, but by the blessing of God, we have actually an old doctor's office that we can move into right there on Blunt Street.
How
It
perfect
couldn't
is
be
that?
any more perfect.
And we are so lucky to have with us Pastor May, who's going to come and tell a little bit about how his vision dovetails with yours and what that's going to mean for the community over there. Pastor May, thank you for joining us today. I appreciate it so much. Tell us some about how you and Jessica have found your missions colliding, I guess.
Well, that's exactly what happened. Jessica and I, our missions, the groups that we have, the Friendship Missionary Baptist Church and the Health and Hope Clinic, we collided some years ago trying to figure out a way to bring access to quality health care to the least and the left out of our community. And when we were brainstorming, our challenge was, what is the location? Do we have a physical place where we can have this Health and Hope Clinic? And providentially, we were blessed to move our location to a larger facility, and it left vacant the prior facility that we had, and we were in a doctor's office, so it made sense that we could bring the Health and Hope Clinic inside of a previously doctor's office, and it went from there, and we spoke with the great people in this community of the different health providers, and they were all on board. And I tell you, we're excited about bringing some quality health insurance to those who wouldn't have it any other way.
I know that the folks at Baptist Hospital are leasing the building. They actually own that building, and they leased it to you, and they're leasing it to you now.
Correct.
As well. So that is kudos to them for keeping their footprint in the community that way. Why was it so important for you? I know that making healthcare part of your church work is something that you have wanted to do for a long time and have looked for a way to do. Why is that so important to you to fit that in?
It's very important because when you look at individuals' lives, whether you're looking spiritually, emotionally, psychologically, you got to look at the person as an entire individual. And if my spirituality is high and my quality of life is low, I'm still not at peace. And so immediately when I began pastoring, our footprint is right next to Baptist Hospital, and I made a phone call over and I said, hey, you're dealing with people's physical needs and we're dealing with the spiritual. How can we do this together so that we can make this person a holistic individual so that their quality of life can totally be awesome? And from there we began to brainstorm, and then a few years later we ran into Jessica in the Health and Hope Clinic, and there, from that point, we began to say, hey, this individual, we just don't want to talk to them about having a high spirituality. We want your life to be a high quality life, and you can't do that if you don't have access to proper health care. And so that's what the Health and Hope Clinic is doing. It's been a part of our mission of the church for a long time, and through the graciousness of Health and Hope Clinic, an extension now will be part of the reality for the Friendship Missionary Baptist Church, and furthermore for the west side of Pensacola, which is one of the most needed areas in our community.
And medically underserved, and those folks who are going to the emergency room for things they don't really need to go to the emergency room for, they're now going to have this primary care venue that they can use.
Exactly.
When I know there's a little bit of work that you all have been doing to the building to get it up and running. What's the target for opening?
Well, I believe that we've discussed a couple of times. We're shooting for the beginning of the new year, maybe January or February. But aggressive work has been going on, fundraising has been going on, and Jessica could probably talk more about this. But we're looking excitedly ready for 2014, January or February, to have this up and running for the west side of Pensacola.
And one of the nice things about that particular location at Blunt Street, I know, is that it's on a bus line. So again, the transportation issue that we touched on is really important, and I know that's going to help. The Olive Baptist location is on a bus line too.
It is.
Well, that was one of the challenges because 9 Mile Road, and as we talked before, if we have the most needed individuals that are inside the city limits of Pensacola, it's hard for them to get to 9 Mile Road to get some of these services. And so bringing them within the city limits on a bus line, it opens up the opportunity for access to healthcare. And healthcare in itself is not the problem, it's the access. Because if I have a good resource, but if I don't have a channel or a vein to get me to that resource, then that resource won't help me. And that's exactly what the Health and Hope Clinic, especially on the west side, is doing.
Well, it's wonderful work. I'm so glad that you two have met up and you're linking up your efforts together. It's wonderful, and I wish you all the success in the world. Let us know how things go, and we will update folks on progress. We'll spread the word. Thank you so much.
Thank you for having us.
All right, my pleasure.